Healthcare is full of people telling you what to do. Start this medication, order this lab, or wipe that ass. And aside from the last one, we're not really taught exactly why. It gets brushed upon in school, but not an in-depth rationale. So hello, my name is Jared. I'm a hospitalist nurse practitioner, critical care nurse, and I've had the privilege of teaching at the university level as a nursing professor. Over the years, I've worked intensive care, hospital medicine, education, and even long-term care in the outpatient setting. One thing that I've learned is that experience that you garner from the bedside, you cannot find in a textbook or a classroom. Throughout my career, I've had countless conversations with many different specialties, RNs, students, nurse practitioners, PAs, or every other specialty you can think of. And most of the time, the questions seem to circulate around very similar topics. Some of them recently have been, how do you know which antibiotic to choose if the culture shows this? What is MIC and how is it important or not important? And how did you know that patient was going to crash? Or most importantly, how do you know when it's time to discuss hospice and how do you have that hospice talk? These aren't questions that always have simple answers. They're questions that require clinical reasoning, experience, and perspective. And that's what you'll find here. Answers. Some are long, some short, but they'll fall likely into one of these four categories: disease deep dives, clinical pearls, real world case discussions, and conversations about nursing, medicine, and healthcare as a whole. Most importantly, we'll focus on understanding the thought process behind good clinical decisions. The bedside has taught me a lot over the years, a lot of lessons. Some have been from great mentors, some have been from those difficult patients you all know so well, and some have been from mistakes, whether my own or witnessed. My hope is that sharing my experiences, I can help make you a better caregiver or provider, a better advocate, and hopefully provide better care for our patients. So welcome to Beyond Bedside Wisdom, where we discuss real nursing, real medicine, and real life. Thank you.